Welcome to the orientation presentation from Department of Pediatric Dentistry. This orientation presentation is made for students who are attending their second clinical posting in the year 3 semester 2. This presentation will discuss the activities that has to be done in these 2 weeks of posting. During your posting, there will be discussion on how to conduct mock counseling session, and these mock counseling sessions are basically done to identify the problem the parents may be facing regarding their child's dental care. We need to educate the parents on the problem. We need to make some recommendations to the parents regarding the problems that they're facing with their children, and then we need to review your recommendations, whether your recommendations are working or not working. So here we will be looking at 4 different types of scenarios where you will be required to do a counseling session with the parents. One would be importance of primary teeth. Basically, these are focused at parents who are unaware of the importance of primary teeth or are ignorant about the importance of primary teeth. So you need to sit with them, you need to identify why they think the primary teeth are not important, and then you need to educate them on the importance of primary teeth, and then you need to recommend things that they need to do to take care of the primary teeth of the children, and then review whether your recommendation is working or not working, or do you need to change your recommendation. Similarly, we will have one for bottle feeding habit, where the parent has a child who is bottle fed and the bottle feeding is causing dental caries. Then you can also have parents who have children who have a very high carcinogenic diet, and then you need to sit with the parent and then you need to identify why the diet is so carcinogenic, and then you need to educate them about a good balanced diet, and then you need to recommend what needs to be changed in the diet, and then you call them back for review to see whether your recommendations are working or not working. And lastly, we will have a more counseling session on habits, where you will learn how to identify the problems the parents face regarding breaking the habits, for example a thumb sucking habit, and then you need to educate the parents on the ill effects of the habits or the adverse effects of the habit on the dentition, and then you need to do some recommendations on how to break the child's old habits, and then you need to review whether your recommendations are working or not working, and if they're not working you need to change your recommendations according to the circumstances. So this is one discussion that we'll have, 4 discussions, and this will be very exciting because you're going to learn a lot of new things, and basically this discussion would be more on your effective listening and effective communication skills. So this is one of the very important parts of pediatric dentistry. We will also look at your assignments. You're expected to complete the assignments for the 3 topics shown on the screen, and this is basically part of your self-directed learning, where you have to read the literature on these topics, and you have to summarize the literature and write it down and bring it to us so that we can sit with you and see what you have learned, and if there are any gaps we can fill it up for you. You need to do all these 3 topics are very important from clinical point of view. For example, age specific oral hygiene. In pediatric dentistry, you have a child who is 1 year old, a child who is 6 years old, and a child who is a 12-year old, right? So the oral hygiene instructions differ for each age group. So you need to be aware of the age specific oral hygiene instructions. You cannot give an oral hygiene instructions of a 12-year-old to a 1-year-old, right? So there are differences. So we expect you to go and find out what the difference is, write them down, and then submit your assignments so that we can have a look at it. Similarly, the assignment number 2, which is on restorative material used in pediatric dentistry, here we need to be sure that whatever materials that you're handling, you understand everything about them. So most of your dental materials you've already learned in your year 1. So all you need to do is go back and you need to filter out the clinical aspects of all the dental materials used in pediatric dentistry, for example, glass ionomer, composite, resin restorations, and any other that you may think is appropriate in pediatric dentistry. You can write them down and bring it to us, and then we'll see how you have done. Typically, say for example, for glass ionomer restorations, you need to understand how to mix them. You need to understand what is the setting mechanism. You need to understand the mixing time, and you need to understand how the restoration performs over a period of year. Similarly, for composite resin restorations, you need to understand the classifications, the flowable, the packable, the microfilled, the different shades. So all this will give you a very good idea when you are faced with a clinical situation where you have to decide which dental materials you need to use for the particular case. And of course, the last topic for assignment is your current concepts in tooth preparation. These current concepts are concepts like box preparation, tunnel preparation, ART, minimal invasive dentistry, sandwich technique, and all these concepts in tooth preparation, which are very useful for your clinical practice. And it may happen that we may come across a situation where you have to use one of these techniques. So you need to be well aware of what are those techniques and how do we do it. And lastly, we have the clinical work that has to be completed in these two postings. There is expected clinical experience, ECE, which are the number of cases that you need to finish before during your clinical posting till your final year. And then once you have your minimum clinical experience, that means the criteria is fulfilling, the patients who fulfill the criteria for MCE, you have to write a reflective writing for those cases. The reflective writing format is available on the e-portal under the General Notice Board of Pediatric Dentistry. You can download it and print it, and you can use this to write your reflective on the cases that you do. The criteria is the child has to be under 9 years of age, and you have to perform some kind of operative procedures, right? For example, scaling or topical fluoride or cavity restoration, extraction. You cannot have an MCE for case history. You cannot have MCE for taking a radiograph. All right, you cannot have MCE for doing a counseling session with the parents, for example, diet counseling. Okay, so these MCE has to be patients under 9 and for whom you have performed a clinical procedure. So you identify those cases and you have to write reflective writing in the format that is available on the portal, and then get it to us so that we can discuss with you how things went and we can suggest some improvements and give you our feedback on that. Once you have completed your 3 MCE and if you're feeling confident to appear for your competency, you can go for your competency. There is no hard and fast rule that you cannot appear for your competency in this posting. But the essential thing is once when you appear for your competency, you should be sufficiently confident on completing the case and managing the child's behavior. And if you're not confident, you go back and do more of EC or more of MCE, it's okay. Okay, and the thing that I need all of you to remember is that in this department we don't treat the tooth, we treat the patient and we educate the parents. All right, so if the patient comes to you with a chief complaint, or say for a chief complaint of pain in a particular tooth, so not only we examine that tooth and come to a diagnosis, but we also carefully look at all the other teeth and make a note of all the things that needs to be done for the patient, and then we educate the parent not only on the chief complaint but also on the other things that needs to be done. And when the parent is educated, he takes positive steps to ensure that all treatment is done for the child. Similarly, when the patient comes for an appointment for a restoration, not only do we do the restoration, but we also again examine the complete dentition, and then the things that needs to be done, the treatment that needs to be done has to be told to the parent, and we have to be educated on why the treatment is necessary, and no parent says no for treatment for the children. So in this way, if you conduct yourself, you're going to develop good communication skills with the parents. You will have a good rapport with the parents, and you'll have automatically you have a lot of work to do in pediatric dentistry, and that is what is our strength in here in pediatric dentistry. I wish all of you luck, and I look forward to seeing you in this posting.